Hello, everyone. We can now continue with week 3 of your newborn baby's development. During this week, your baby becomes more awake, more active, and physically stronger. This is also the period when colic pain, commonly known as gas pain, may begin to appear. However, colic is not caused only by gas. Many different factors can disturb your baby and lead to intense crying episodes. This means that babies enter a general colic phase, where crying may increase for various reasons. Expectations during this period are relatively simple and predictable. Your baby will continue to sleep 16 to 18 hours per day. By the end of the first month, daily weight gain should be around 20 to 30 grams. Total length increase in the first month is approximately 4 to 5 centimeters. Time spent with parents increases significantly during this period. Week 3 is extremely important for facial expressions and early language development. Gestures, facial mimicry, tone of voice, and the way parents speak play a critical role in future communication skills. Creating a bedtime routine is highly recommended. Giving your baby a bath before sleep helps establish consistency. Evening baths followed by gentle baby massage can help your baby relax and prepare for sleep. A baby's comfort is also closely related to maternal nutrition, especially during breastfeeding. It is advisable to limit or avoid coffee, tea, cola, chocolate, raspberries. Severe vomiting, especially projectile vomiting, may indicate hypertrophic pyloric stenosis, a condition that commonly appears around the 20th day of life, during the 3rd week. This is a medical condition specific to this period and requires immediate medical evaluation. If there is blood in the stool, your baby should be evaluated for cow's milk protein allergy or other pathological conditions. Any issues related to poor weight gain, feeding refusal, or unusual symptoms should always be discussed with your pediatrician. Week 3 is a crucial period for starting tummy time. Babies should be placed on a flat, firm, and clean surface. The sleeping surface should not be soft. When placed on their stomach, babies will begin lifting their heads occasionally, which supports neck, back, and core muscle development. There is no need for a strict schedule. 10 minutes per session is sufficient, and tummy time should only be done while the baby is fully supervised. The 3rd week is an excellent time to begin going outside with your baby. Fresh air and sunlight are beneficial. This is also an appropriate time to introduce visual stimulation tools, such as play mats, baby mobiles, moving or high-contrast toys. These help support sensory and cognitive development. If your baby has been circumcised, healing should be complete during this period. If healing has not occurred, medical evaluation is necessary. Once healed, normal bathing routines may continue. If the baby is not circumcised and there appears to be tightness at the tip of the penis, it should not be forced. Natural opening often occurs by around 5 years of age, but early evaluation by a pediatric surgeon or urologist is recommended. Urinary tract infections are more common in male infants under 1 year of age, especially in uncircumcised babies. Hormonal effects in newborns. Babies are exposed to maternal hormones during pregnancy. As a result, Female infants may experience mild vaginal discharge or slight bleeding, which is considered normal during this period. Another common issue in week 3 is blocked tear ducts. If your baby wakes up with discharge or crusting in the eyes, especially in the morning, tear duct blockage may be present. A doctor should check for infection. If blockage is confirmed, gentle massage using the little finger may help regulate tear flow in both eyes. Keeping the area warm may also support natural resolution without medication. Babies may develop neonatal acne, dry or peeling skin, cracks or flaking. Bathing frequency can be reduced to 2 or 3 times per week. Daily bathing is unnecessary. Use gentle, baby-friendly shampoos designed for sensitive skin. Avoid harsh detergents, soaps, and diaper products. Using a baby comb during baths may help reduce irritation. Supervised diaper-free time at home can also support skin healing. Pacifier use is a topic with differing opinions. The American Academy of Pediatrics states that pacifier use reduces the risk of sudden infant death syndrome, SIDS. Another perspective suggests avoiding pacifiers to support balanced feeding patterns. Both approaches are acceptable. If a decision is made, consistency is important. Neither option is considered incorrect. Previous recommendations suggested starting vitamin D after 10 to 15 days. Current guidelines advise vitamin D supplementation from the first day of life. Continued use until 1 year of age. Feeding and milk storage. During the 3rd week, milk supply is fully established. Feeding intensity begins to decrease slightly after the first 10 days. This makes week 3 an ideal time for mothers who plan to return to work to begin storing breast milk. Babies continue to sleep 16 to 18 hours per day. Although they cannot yet distinguish day from night, early circadian rhythm development begins during this period. Bathing, massage, reading stories, and calm interaction before sleep can support emotional bonding and future language development. According to the American Academy of Pediatrics, swaddling is recommended only under specific conditions. Baby must be placed on their back, never on the side or stomach. Hips and legs should be wrapped loosely. Feet must be able to move freely. Swaddling should be stopped once the baby begins rolling over. By week 3, newborn jaundice should have resolved. Persistent signs require medical evaluation. Parents are encouraged to take short breaks, maintain hydration, and consider vitamin supplementation after consulting a doctor. Daily sunlight exposure for 10 to 15 minutes is beneficial. Week 4 is approaching, marking nearly 1 full month of life and significant progress. Although this period can be physically and emotionally demanding, especially with colic, patience and calmness are essential. Even if this content has not yet reached a large audience, the goal is to provide accurate and genuinely helpful information for parents. Take care, and see you in week 4.